my great pleasure and privilege to chair the first of our afternoon sessions. I serve with Dr. Lemon as co-chair of the Scientific Advisory Board of ADAO. Obviously, we've had lots of discussion about that wonderful organization today, and for me it's an honor to work with Linda and the others active in the organization, and really to work with all of you. My role today is simply to introduce our speakers this afternoon for the first of our two sessions. And what I'd like to do by way of housekeeping is to introduce all of the speakers, ask our first speaker to then come up, and then just ask as one speaker finishes to have the others just follow on. Please, for the sake of our timing today, as much as the urge is to go on, because there's a lot of important things to say, see if you can't keep your talks to 20 minutes. It's also rather special because of all the presenters this afternoon. I've had a chance over the years to meet and interact with each one of them, some more than others, but all of these individuals are known to me, very different from a lot of conferences where you get asked to introduce people and you don't know who they are or what kind of work they do. Our first speaker this afternoon, you've heard his name mentioned already this morning, will be Jim Brophy, who's the Executive Director. Dr. Brophy is the Executive Director of the Occupational Health Clinic for Ontario Workers in Sarnia, and will speak to us about asbestos disease in Sarnia, Ontario. We had the presentation this morning on the clinical aspects. Now we're going to get, I'm sure, a somewhat broader overview.
Well, I want to start by, first of all, really thanking Linda and the organizers of this conference for allowing a number of us from Canada to come and talk about the stories of workers in the communities in which we live, about their stories about asbestos. And I want to congratulate the organizers for having this very civilized thing where they actually give you time limits over here and they show it to you. We're not used to that in Canada. Usually there'd be somebody with a hook here. Anyway, so this is something for us to learn from. I also want to say that I agree with other speakers of the points they've made, what really wonderful presentations there have been and how much we've all learned from them. My presentation has been slightly abridged through the internet, and I'm not sure what slides are coming up, so if you'll, I'm sure I'll be able to get through in 20 minutes now. I want to tell you, because I know everybody's had lunch, and I understand that you know, has a tendency toward making one sleepy. I'm just going to tell you in 3 points what my whole presentation is going to essentially tell you, or show you. First of all, I'm going to show you the largest asbestos disease cohort documented in Canada today. That we have a community, an industrial community, in which among the blue-collar workers that worked in the chemical valley, in the petrochemical industry and related industries in the 60s and 70s and 80s, there is not a single family that hasn't been adversely affected by what I'm going to show you. That we have a community, as we heard before about individuals, we have a community in trauma. And this trauma was not recognized, accepted, acknowledged, which further traumatized everyone who was dealing with this situation on a one-to-one basis throughout this community. But because of really the women, the wives of many of these diseased and sick workers, that whole situation has been fundamentally changed. And picking up on Dr. Frank's point, we have 1,000 workers that we are following now with asbestosis or pleural plaque through a whole program of surveillance. So this issue that this is a long-term process is for certain. And then finally, I would just want to also say what Dr. Frank was saying about the banning, meaning that we're still facing this for many years. I just want to say that if we ban it in North America, it does not mean that the asbestos problem has gone away. These industries are parking themselves in developing countries where workers have no defense against these industries. And what I'm going to show you in Sarnia today, the seeds for it are being reproduced in India and Bangladesh and Thailand and throughout Latin America and in Africa and any place that this industry can find itself. So this, I I guess everybody knows where you are. So we're about 100 miles from here, just down, or an hour's drive, I guess, if you drive through the States, from Detroit. We are the center of the petrochemical industry. We have a population of Sarnia itself. It's about 72,000. Lambton County takes it up to about 150,000 people. 20% of Canada's refineries are located there. 40% of Canada's chemicals are produced there. And we have the largest asbestos disease cohort in the country. You'll notice a lot of similarities between Warren's pictures and my pictures. And we think it's good to show everything twice. So as we mentioned, we are one of 5 clinics. My colleagues from Windsor are here, the Windsor Clinic. We have our national or provincial chairperson, Lyle, many people from the National Ban Asbestos Movement, but we are one of 5 clinics. We're a group of doctors, nurses, researchers, hygienists, and our major approach has been, first of all, medical diagnosis of work-related disease, community-based investigations, and public education. I just wanted to say, and this is I guess one of my slides is missing, we just did a report with EcoJustice looking at National Pollution Release Inventory information for 2005, as well as in the American Toxic Release Inventory. And what we have found in Sarnia is that the industry in 2005 was releasing over 5 million kilograms of toxic substances, 16 million tons of greenhouse gases, more than the whole province of British Columbia. And we are working very closely, and more toxic releases, which includes carcinogens, reproductive hazards, neurotoxins, developmental toxins, and so on and so forth, than the province of Manitoba. And we are working very closely with the First Nations community that lives at the fence line, the Aamjiwnaang community, and we've documented the skewed sex ratio, birth ratio in that community, as well as a public health study that is finding high rates of miscarriages, cancer, learning disabilities, and asthma, and other illnesses among their children. I show you this to contextualize that you have 2 parallel events going on, 2 parallel stories, one among the blue-collar industrial part of the community and one among the environmentally exposed, and particularly our First Nations community. So, the asbestos story. Well, this story was well known by the Canadian government. We saw earlier presentations, Richard Lemon's presentation, for instance, in Quebec, and of course that was repeated in Ontario. This is something we received in 2000, although they tried to take it back once we had the letter with the information in it. But this is a hospitalization data in Lambton County looking at the rates of cancer, mesothelioma, asbestosis, and a whole other ranges of asbestos-related disease. I know we've been focusing mostly on mesothelioma here, but let's not forget that among asbestos-exposed cohorts, mesothelioma is not the most prevalent cancer, or even necessarily the most prevalent deadly fatal cancer, that there's usually twice as much lung cancer as there is than mesothelioma. 2 cases for every 1 case of mesothelioma. The public health people knew this, but as Warren mentioned, these diseases were so prevalent in the community that no one took particular care about it. And this is another slide, once again, that Warren and I shared with each other. This shows the Cancer Care Ontario, again, not for circulation. There were high rates of mesothelioma that were actually known by the federal government well into the mid-1980s, but were not shared with the community. No one in the community was being told about what was being documented by the governmental agencies, either locally or public health governmental agencies. I'm going to give you a couple of case studies. This is one, the Holmes Foundry. It was 3 facilities, the Capacite plant where they produce asbestos insulation for the Chemical Valley, the Holmes Foundry insulation fiberglass plant, and the foundry itself, which started producing in 1919 the engines, the blocks for the Model T. And there were, at the time, any one time, there was between 300 and 625 workers, 7,000 workers in all. It closed in the late 1980s. When our clinic, the genesis of our work in Sarnia actually began in Windsor. I was the director of the Windsor Clinic, and we were asked to go to Sarnia as part of our mandate to go and assist the labor movement there. When we arrived, and that was myself essentially, one of our nurses, one of our physicians, we did not know anything about asbestos-related disease. We had no idea that it was there. And for the first few months that we were there, we saw essentially back injuries, old comp files, and so on. And then we started seeing asbestosis, mesothelioma, and other diseases. One of the people who contacted us was the former Canadian Auto Workers plant chairperson, a person by the name of Bob Clark. The plant had been closed 5 or 6 years. He was, or had already contracted pancreatic cancer. He was helping former Holmes workers that were sick. And he said, I am sick, I can't do this, could you help us? And we said, well, sure. We didn't know anything about the plant. So we got together using techniques actually that my partner, Dr. Margaret Keith, has been advocating and developing, where we brought groups of workers together, not knowing what the exposures were. We had no idea that asbestos was the major. I was thinking Foundry, I was thinking silica and isocyanates and so on. And we got them together, these were retired workers, and we put this big piece of Bristol board up and we said, okay, draw the plant for us. Show us what it was like. And so they started drawing what it was like. And so this is what it was like in 1950. And then we said, what's it like, you know, in 1960? Was it the same? Well, oh no, well, we changed these operations. We were trying to document what the possible exposures might be. And Margaret took a group from the Capacite plant, and she went off into another room and she drew this picture. And then we came back after lunch and we showed everybody the picture, because these workers worked in these facilities together. And within 5 minutes, we knew there was an asbestos disease, an asbestos exposure catastrophe, not to mention a disease catastrophe. The descriptions that these workers had, there were 2 workers that spent on the midnight shift whose job was to go around with an air hose and get all the asbestos debris off the machines, because there was so much asbestos debris that if they didn't do that, the next morning the machine wouldn't operate. So this is actually, this is Ralph Crevier. His whole family ended up dying of asbestos-related disease. His 4 brothers, his father, and 2 of his sisters, who never worked there. So with the Canadian Auto Workers, we organized what we called an intake clinic. The union sent out a letter to all the former workers and said, if you think you have health problems and they might be related to your work, could you come to this clinic on this given day? We will document this, and if there is a connection, we will try to assist you with compensation and so on and so forth. And I won't go into the long and short of how this happened, but we actually said to the union, would you use the Freedom of Information Act, go get the ministry and government inspection records, let's check see if they knew what was going on here that the workers had told us. And the CAW did that. And I was asked to write a report from them, and I just want to share what we found about the Capacite plant, just briefly. Starts off in 1958. The letter goes from the management of the Capacite plant to the Deputy Minister of Health, because in those years that's who was responsible for occupational disease in Ontario, and says, we're working with asbestos. Asbestos miners in Quebec have all kinds of health problems related to asbestos exposure. We're concerned, does that have any implications for us? 2 days later, I'm just reading you what's in the documents here, which we've actually written up and it's published. What the company writes back, or the ministry writes back and says, we don't know, you're right, the asbestos miners have all kinds of respiratory disease, but we have to come into your plant and we'll have to find out what was going on there. What's funny about that, depending on your sense of humor, is that at the same time they're telling that to each other, they're telling the asbestos miners there's no problem with asbestos exposure. So they come into the plant in 1958. They are a very proud group. They've got new equipment from Bausch & Lomb, state-of-the-art, sampling equipment. Within an hour, the equipment clogs. There's so much asbestos. It shuts down. They find levels that are 6,000 times over their own standard at that point. They leave. They don't write any orders. They don't tell anybody, because remember, until 1978 in Ontario, workers had no legal right, or there was no obligation to tell workers at all about the exposures they were facing. In fact, through this whole period, the workers are never told. The population at risk is never told. They leave. They don't come back for 9 years. When they come back, they're now using 10,000 pounds of asbestos a day, some of it from the warehouse in Tyler, Texas, which opens up Paul Brodeur's book. You know, OSHA's suing, they shut this company down. All that asbestos in the warehouse, it goes to Sarnia, to Hamilton, to the Holmes Foundry. Now they're at almost 2,000 times the level. This time, thank God for the Canadian government, they write 9 directives about the ventilation system, about the way people are working and so on. They don't tell the workers. These are not shared with any of the people doing this work. They leave. They come back 5 years later. When they come back, now for this 2-year period, they now say in their documents they are now measuring the highest levels of asbestos ever measured anywhere in the world. They are over 8,500 times the legal level. They never shut down the operation. They never prosecute anyone. They never tell anyone. It's not until 1974 and the plant closes down that this stops. In these Freedom of Information documents is a Ministry of Labor. That's the report we wrote. And this is an exposure profile that we did that was used then for compensation claims. And I just want to say, in this epidemiological report that the Ministry of Labor had done in the 1980s, they found that these workers were dying of lung cancer 6 times greater than the general population, 9 times greater for respiratory disease, asbestosis, 4 times greater for all other malignancies, and it did not include 5 cases of mesothelioma, all of the workers under 60 years of age, 3 under the age of 50. So at this, and I'm going quickly here, at this intake clinic, 300 workers and their families showed. We have seen over 1,000 of these former Holmes workers. We've established almost 300 compensation claims for asbestos exposure and almost 400 for other related issues. The last time that the union was able to gather how much information there are, the settlements, it represents over $22 million in compensation awards through our compensation system, because in Canada, workers do not have the right to sue. Some of the unprotected people, there was a 16-year-old boy who died of mesothelioma, whose father was a foundry worker who brought it home on his clothes. And of course, this created a national outcry around asbestos disease, and actually changed pretty much everything that was going on in the community. The building trades workers, at first we thought this might be just confined to this horror show, this killing fields at the Holmes Foundry. But other workers, the building trades workers, said that they were establishing or finding very high rates of asbestos-related disease, as we were told this morning about the insulators, but not just them. Oh. Actually, this is one of the things I lost. We mapped on big Bristol board using a silhouette of the body every person who came into the building trades clinic. And we marked down, if they said you had hearing loss, we put a dot there. If they said they had cancer, we put a dot there. If they said their hands and feet were sore and they couldn't use them, we put a dot there. And I'm telling you, these pictures, and I'm sorry it didn't make it through the internet, shows, I think, perfectly what it means to work in the trades for 25 or 30 years. They can't hear. There was so much respiratory disease, we had to create a second set of lungs. Every time they come and see us, we send them off for a hearing test and a breathing test. They all come back with either industrial hearing loss as well as respiratory disease. They are the biggest group of workers. These are the skilled tradespeople of the chemical industry in our cohort. We have seen almost 1,500 of these workers. As you can see, the kinds of diseases that we've seen, lung cancer, GI cancer, mesothelioma, head and neck. I also should mention, and this is the chemical workers here. Now, this is a third case study where we've seen 1,100 of these workers, and we filed over 500 Form A's, which is compensation for work-related disease, and you can see the same pattern of illness. And I am only focusing here on asbestos. I just want to say that among blue-collar workers, they bear a preventable cancer risk that is, first of all, being denied and ignored. But asbestos is only a portion of it. the exposures to asbestos are only a portion of it, but because those diseases are identified with that exposure, we see them more clearly. The number of workers with lymphoma, with leukemia, with pancreatic cancer, kidney cancer, and a whole other range of diseases, Parkinson's, ALS, and so on, brain cancer, we're not showing those people there, but they arise from other exposures that these workers had in that industry. Among the over 4,500 workers that we've seen, over 50% of them have been exposed to asbestos. This is, because our database is often a little wonky and we've seen that loose cases, our best estimates in terms of the numbers we actually show there of what we've seen since 1999 until the end of last year. But you can see this is just the asbestos-related diseases that we see. For 2004, 2005, and 2006, we registered a new patient every week, on average, with mesothelioma or asbestos-related lung cancer or asbestosis. In 2007, we registered a new patient with asbestos-related disease 4 out of 5 days a week. We have over 1,000 workers, about 900, as Warren said, 925 with either pleural plaque or asbestosis, and another group of about 75 to 100 who have had extensive exposure to asbestos that are participating but don't show any radiographic evidence of this exposure. And we are working with Princess Margaret Hospital in Toronto, and every week a group of these workers go up in a van and are being scanned with low-dose CT scan with the hope that we can detect early-stage lung cancer. I take Lyle's point that we do love our country, but all of us that are here are ashamed of its support for the continued exposure of workers in the world, not just in Sarnia, not just in Quebec, not just in the shipyards in BC and in the Maritimes, and in factories in Windsor like Bendix, but who have knowingly taken this product and have shipped it and have planted it into the third world, where the ILO now estimates that 100,000 people a year are dying globally from this totally preventable set of diseases. And this is a statistic, I think actually I've taken it from Barry Castleman, about how much every miner is contributing for every ton of asbestos that we ship to these countries where the workers have absolutely no defense against these exposures. So this is the memorial that the widows in Sarnia constructed that exposed this long legacy of disease and denial. And if the picture was better, you'd be looking at the memorial and you'd go through, you'd look through and there's the family, and then behind you'd see stacks and stacks of the industry that sits behind on the river. And I want to acknowledge the victims of Chemical Valley, the women who have done this, and Margaret Keith and Jenny Skeeman, who's here, and to say that we're all part of this band, so we're reaching our hands across the border to you as well.